Welcome to News at 10. I'm Brendan Lepore. Made on the Prevention and Control of Infectious Diseases Act 92 to improve the effectiveness of the pandemic. Minister in the Prime Minister's Department, Parliament and Law, Datuk Sri Taqiyuddin Hassan, said this includes amendment on general penalty under Section 24.
Di dalam Seksyen 24 akan jumlah denda bila dibawa ke mahkamah biar saja, yang mana bidang kuasa mendendanya hanya 25,000. Tapi pindaan telah dibuat dalam Seksyen 24 ini dipinda, di mana dendanya dinyatakan RM100,000. Ini bermakna bahawa kes yang berkaitan COVID tidak lagi akan dibawa ke mahkamah magistrate. Sebaliknya akan dibawa ke mahkamah session, mahkamah yang lebih tinggi. Boleh denda sehingga RM100,000.
Meanwhile, Datuk Sri Taqiyuddin also said that during an emergency, as Yang di-Pertuan Agong Sultan Abdullah make ordinances as provided for under Article 150, subsection 2B of the Federal Constitution. The Minister further explained that Article 14, subsection 1 of the Emergency Essential Powers Ordinance 2021 also clearly states that the provisions relating to the summoning, proroguing and institution shall have no effect when an emergency is in force. He added that the decision was also taken based on scientific facts and data gathered in relation to the pandemic. The order to wear a tracking device is among the 5 new provisions under the Emergency Prevention and Control of Infectious Diseases Amendment Ordinance 2021, which will come into force on 11 March. Health Minister Datuk Sri Dr. Adam Babar said the high-tech device is the form of a wristband. It is aimed at controlling movement, especially individuals tested positive for COVID-19. The minister said the device is to be worn for 10 days.
Dia berkisar kepada 3 keadaan, iaitu confirm case, iaitu mereka yang dirawat di hospital atau dirawat di PKC atau dirawat di rumah. Sekarang kita dah ada CAC COVID-19 Assessment Center yang membolehkan kategori 1 dan 2 diletakkan pengasingan di rumah. Sebab tu kita perlukan peranti khas teknologi terkini. Yang itu satu. Kedua ialah kepada mereka yang disyaki telah dijangkiti penyakit berjangkit. Itu dipanggil PUI, Person Under Investigation. Person Under Investigation ni kita telah buat saringan COVID-19 antigen yang perlu disusuli dengan RT-PCR kerana hubungan mereka dengan kontak rapat yang sangat terdedah dan juga balik daripada kawasan-kawasan yang dikatakan kawasan merah. Jadi itu dipanggil person under investigation. Yang ketiga ialah kategori PUS, iaitu person under surveillance.
He said a penalty would be imposed if the tracking device is destroyed, damaged, lost or altered. Meanwhile, other new provisions included under the ordinance is Section 21A that empowers the Health Director General to issue any general or specific instructions to any people to implement infection prevention and control measures. Another new provision is Part 4A that enables powers of investigation and powers to give information in relation to the prevention and control of infectious diseases, while Section 22A of the new provision enables corporate bodies to be charged with offences under Act 342, and a new Section 31 empowers the authorities to impose penalties under the Prevention and Control of Infectious Diseases Act 1988, Act 342, for any offence not stated in it. Meanwhile, the Health Minister said Malaysia will issue a smart vaccination certificate to the people in the country who have been vaccinated against COVID-19. Datuk Sri Dr. Adham said the certificate will be issued in a month's time and the matter is being discussed with the World Health Organization, WHO, to ensure that the document is also recognized by other countries.
Saya telah pun mengadakan persidangan secara maya dengan WHO, iaitu International Health Regulation yang WHO. Kita akan update dia panggil Smart Vaccination Certificate dalam masa sebulan lagi untuk kita nyatakan tentang dia panggil Smart Vaccination Certificate ataupun pasport vaksin.
ASEAN economic ministers have proposed a common digital vaccine certificate to speed up the reopening of hardest-hit sectors such as tourism. However, Senior Minister cum International Trade and Industry Minister Dr. Sri Muhammad Azmin Ali said there was no specific timeline set when the certificate would be introduced, as the matter would be brought up to the health ministers' level meeting.
Sekiranya kita dapat mewujudkan vaccination certificate ini, ianya pasti akan memudahkan perjalanan masyarakat perniagaan dan juga memulihkan semula sektor pelancongan. Tetapi kita juga mengambil maklum tentang beberapa cabaran semasa kerana vaksin yang digunakan oleh negara-negara anggota ASEAN ini berbeza-beza daripada pelbagai manufacturers.
The minister said this after the 27th ASEAN Economic Ministers Retreat in Kuala Lumpur. On another note, Dr. Sri Muhammad Azmin said Singapore has assured Malaysia that the suspension of the reciprocal green lane RGL between both countries, which is causing much difficulty for businesses on both sides of the border, is temporary. He said the RGL arrangement will resume once the COVID-19 situation improves, and the Republic's vaccination program would also include Malaysians who are residing and working there. Private hospitals are already being used as vaccination centres for private healthcare workers for Phase 1 of the National COVID-19 Immunisation Programme. Science, Technology and Innovation Minister Khairi Jamaluddin, who is also the coordinating minister for the National COVID-19 Immunisation Programme, said the government will include more private hospitals for Phase 2 and 3 as announced previously. Elaborating further in a Twitter post, Khairi said the vaccination will all be hands on deck as 75,000 to 150,000 vaccinations per day throughput is for later phases. He was replying to former Health Minister Dr. Sri Dr. Zulkifli Ahmad's tweet, which stated that the government should engage the private sector in a public-private partnership that is both effective and transparent for the COVID-19 vaccine rollout if public hospitals' capacity is insufficient. Dr. Sri Dr. Zulkifli said it was to ensure the success of the immunization program and achieve herd immunity earlier. Malaysia kicked off the first of the national COVID-19 immunization program's 3 phases on 24th February, with the first rollout to take place from February to April this year, involving 500,000 frontliners. The second phase will be from April to August, involving senior citizens aged 65 and above, high-risk groups, as well as persons with disabilities, PWD, involving some 9.4 million people, while the third phase from May this year to February 2022 will cover both Malaysians and non-citizens aged 18 and above, targeting more than 13.7 million people. The first batch delivery of AstraZeneca COVID-19 vaccine to Malaysia is expected to arrive in the second quarter of this year. The country's pharmaceutical company's president, Dr. Sanjeev Panchal, said the company will continue to fulfill the commitment to provide broad and equitable access at no profit. He said they're currently working closely with the government to help stamp the pandemic, enable people to return to normalcy and pave way for the country's economic recovery. Today, the AstraZeneca COVID-19 vaccine has been granted conditional registration approval in the country by the National Pharmaceutical Regulatory Agency (NPRA) for active immunization of individuals 18 years and above for the prevention of COVID-19. Dr. Sanjeev said the approval marks another important milestone following a landmark agreement with the government and aims to supply 6.4 million doses of AstraZeneca COVID-19 vaccine to millions of Malaysians. He also said that clinical trials found that it was 100% protective against severe disease, hospitalization and death, more than 22 days after the first dose, where a single dose of the vaccine has an efficacy of 76% against symptomatic COVID-19 in the first 90 days after vaccination. He said vaccine efficacy after the second dose was higher in those with a longer interval, reaching 81.3% in those with a dosing interval of 12 weeks or more. And research also indicates that it reduces transmission of the disease by 67%. Malaysia is currently waiting for quota allocated by the Saudi Arabian government for this year's Hajj season to coordinate on COVID-19 vaccine shots. This comes after the Saudi's health ministry has ruled that only people who have been vaccinated against COVID-19 will be allowed to attend the Hajj this year. According to Minister in the Prime Minister's Department, Religious Affairs, Dr. Zulkifli Muhammad Al-Bakri, Malaysia welcomed the decision made by Riyadh, adding that the government is now waiting for the quota allocated for Malaysian Muslims to visit the Holy Land. He said following that, the government will study all procedures and guidelines introduced by Riyadh in order to ensure the safety of all future pilgrimages. In 2020, the kingdom dramatically reduced the number of pilgrims to around 1,000 to help prevent the spread of the coronavirus after barring Muslims abroad from the rite for the first time in modern times. Hajj, a once-in-a-lifetime duty for every able-bodied Muslim who can afford it, is a major source of income for the Saudi government. Crowds of millions of pilgrims from around the world would likely be a hotbed for virus transmission, as in the past some worshippers have returned to their countries with respiratory and other diseases. Now, in case you missed out on the COVID-19 updates, Malaysia new COVID-19 cases rose slightly today, a day before the movement control order will be lifted for all remaining states, but remain below the 2,000 mark with 1,745 new infections reported. The number of active cases has also dropped to 24,025 after 2,276 recoveries made in the last 24 hours. In a statement today, Health Director General Tan Sri Dr. Nur Hisham Abdullah explained that Selangor reported the highest new infections by state, with 640 cases, followed by 376 in Johor and 139 in Sarawak. The death toll also rose to 1,148 after 7 fatalities reported today. Currently, there are 195 patients being treated in the intensive care unit, with 95 of them requiring ventilator support. The Health DG also reported the emergence of 11 new clusters, 9 of which related to workplace in Selangor, Johor, Kelantan, Kedah, Pahang, Melaka and Negeri Sembilan. Selangor police have managed to bust a drug trafficking syndicate in Klang Valley and seizing 69.065 kilograms of methamphetamine worth 3.1 million ringgit in 3 separate raids in Sedang and Ampang Jaya. Acting Selangor Police Chief Dato' Arjunaidi Muhammad said 3 suspects aged 24 to 38 were also arrested by the Selangor Contingent Police Headquarters Narcotics Criminal Investigation Department during the raids on 26 February.
Hasil siasatan yang kita telah lakukan, kumpulan ini yang telah bergerak sejak awal tahun ini, untuk pasarannya di Lembah Kelang, dan ketiga-tiga suspek ini adalah merupakan mereka yang merupakan kurir ataupun mereka yang memainkan peranan untuk membawa dadah ni. 2 lelaki Melayu dan 1 lelaki Cina tempatan. Berdasarkan risikan kita dan pemerhatian yang kita buat pada masa tersebut, mereka dalam proses untuk membawa dadah tersebut, yang mana 2 lelaki Melayu ni telah menyerahkan dadah berkenaan kepada lelaki Cina untuk pengedaran di sekitar Lembah Kelang.
He said all 3 suspects have been remanded under Section 117 of the Criminal Procedure Code for 7 days beginning 27 February till the 5th of March, while checks revealed that all 3 suspects did not have prior criminal records. The case is classified and investigated under Section 39B of the Dangerous Drugs Act 1952. Still to come, government reaches another settlement on 1MDB scandal. Stay with us. The retail prices of RON 97 and 95 petrol and diesel will remain unchanged for the period of 4 to the 10th of March. The Finance Ministry in a statement today said this is based on the weekly retail pricing of petroleum products using the automatic pricing mechanism APM formula. The statement said in order to protect consumers from the effects of rising oil prices in the global market, the government will maintain the ceiling price of 2 ringgit and 5 cents per litre for RON 95 petrol and 2 ringgit and 15 cents per litre for diesel, although the APM retail price for RON 95 and diesel had risen by more than 10 cents compared to the stipulated ceiling price. It added that the government will continue to monitor the impact of changes in the world crude oil prices and take appropriate measures to ensure that the welfare and well-being of the people continue to be maintained. Deloitte PLC has agreed to a 324 million ringgit or about 80 million US dollar settlement to resolve all claims related to their fiduciary duty on auditing the accounts of 1MDB and SRC International from 2011 to 2014. The Ministry of Finance in a statement said the amount represents the largest 1MDB related settlement by an audit firm in Southeast Asia. According to Finance Minister Tengku Datuk Seri Zafrul Tengku Abdul Aziz, the successful out-of-court settlement with Deloitte will expedite the payment of monies to fulfill 1MDB and SRC's outstanding obligations, which would otherwise be delayed by potentially protracted and costly court battles. He said the settlement marked another success in the Malaysian government's continuing recovery efforts against parties involved in 1MDB, SRC and its related entities. He added that the Malaysian government is determined to ensure that appropriate actions are taken against all individuals or entities involved, directly or indirectly, in the global 1MDB scheme. The announcement today comes just less than a week after the Finance Ministry's success in striking a deal with AmBank Group's holding company, AMMB Holdings Berhad, for the banking group to pay 2.83 billion ringgit as global settlement of all claims related to its involvement in the 1MDB matter. This is on top of the Malaysian government's July 2020 success in negotiating with Goldman Sachs on a 15.8 billion ringgit settlement on the 1MDB matter. The statement also added that these settlements will neither affect nor compromise Malaysia's claims against individuals like Jolo and other parties related thereto, and who are still being actively pursued in relation to the 1MDB scandal. Lembaga Tabung Haji TH aims to provide stable profit distribution to depositors after announcing a stable financial position, with total assets exceeding total liabilities by 3.68 billion ringgit for the financial year ended 31st December 2020. Group Managing Director and Chief Executive Officer Datuk Nik Muhammad Haziuddin Yusof said the total assets stood at 81.85 billion ringgit and total liabilities were 78.17 billion ringgit. In a statement, he said a more sustainable distribution rate was crucial for TH because pilgrims who need to wait for their turn for the Hajj pilgrimage due to a quota set by the Saudi Arabian government. TH announced a profit distribution of 3.1% after zakat for financial year 2020, which involves a total amount of 2.24 billion ringgit compared with 2.14 billion ringgit for 2019. For this year, he said TH expected a more challenging operating environment where investors would be pressured to look for higher returns amid a soft economy. TH will also continue its efforts to rebalance its investments portfolio, especially in replacing low-yielding assets with those that can provide better returns to depositors. Some 1.5 million Tenaga Nasional Berhad TNB account holders in Melaka and the Klang Valley will be equipped with smart meters by end of this year. TNB Advanced Metering Infrastructure Project Director IR Muhammad Gaus Ahmad said so far about 1.06 million of the meters had been installed in both areas. In Melaka, he said TNB had installed about 300,000 smart meters, while in the Klang Valley area, about 706,000 houses had been installed with the equipment. Muhammad Gauss said TNB was also in the process of obtaining additional allocation from the federal government to provide the smart meters for all the 3 million TNB subscribers in the Klang Valley. Meanwhile, TNB Selangor retail head Ismail Latifi Teh said the installation of the smart meters will give various advantages to customers, including allowing them to monitor their total daily electricity consumption. He hoped more TNB users would download the app and take advantage of it. He also advised the public to contact the TNB through their customer service line if they have any doubt on individuals or contractors who appear at their premises to change the meters. South Korea probing 2 deaths after AstraZeneca's COVID-19 vaccine. That and more coming up in our foreign segment. Our top story, mandatory high-tech wristband for COVID-19 patients and close contacts. Join us again at 12:30 tomorrow afternoon. Till then, I'm Brendan Lepol. Stay tuned to Saluran Berita RTM and have a pleasant evening.